My Story is presented by Island Cancer Center, Guam Behavioral Risk Factor Surveillance System, and Tobacco Free Guam.
Hafaday, and thank you for joining us for this episode of My Story. I'm Janella Carrera. My Story was created in May 2015 to bring cancer and cancer prevention to the forefront. And cancer is a word that we have all heard, but do we really know what cancer is? Well, in this episode, I will sit and talk with Island Cancer Center's oncologist, Dr. Kin Sing Ao, as he explains what cancer really is. Then later, I will sit with a mother as she shares her breast cancer survival story. We will also chat with her daughter, who was just 12 at the time her mother was diagnosed with the dreaded disease. We will stick with the topic of breast cancer through this entire episode. And with that said, a medical professional will share her knowledge on breast cancer prevention and treatment. And according to a local study done by the Guam Comprehensive Cancer Control, there are 5 cancers that amount for a majority of Guam's cancer burden. Of the 5, breast cancer comes number 1. And the Cancer Research Center of Guam's 2014 statistics show 292 new cases of breast cancer. Between 2008 and 2012, breast cancer claimed the lives of 37 of our beautiful island women. And the study also shows that in 2012, 72% of Guam women aged 50 years and over had a mammogram within the past 2 years. In the United States, there has been a decrease in breast cancer death rates, which is believed to be the result of earlier detection through screening and increased awareness, as well as approved treatment. So be sure to get screened or even do your self-breast exams every month. And don't be fooled, though, although it is rare, breast cancer can happen in men, too. According to an American Cancer Society study done in 2015, breast cancer in men accounts for approximately 1% of breast cancer cases in the United States. My Story starts now. Welcome back to My Story. We will start this episode with a one-on-one interview with Island Cancer Center oncologist Dr. Kin Sing Ao. I'm Janella Carrera. Dr. Ao graduated from Johns Hopkins University School of Medicine in Baltimore, Maryland, and completed his internship and residency in internal medicine at Georgetown University Hospital. Then in 1988, he was the chief resident in radiation oncology at the University of Arizona Health Science Center. And Dr. Ao is U.S. trained and board certified and joins us from Inova Loudon Hospital in Virginia, where he has been the clinical director of radiation oncology since 1991. And with his fascinating resume, we believe he is the perfect individual to explain and break down what cancer really is. Here is that interview now. All right, Dr. Ao, well, welcome to the show and welcome to My Story. I'd like to start off by asking you about your background. I understand you're an oncologist. Can you tell us a little bit more about what you do?
I'm Dr. Ao. I'm from Virginia. I'm a radiation oncologist and I graduated from Johns Hopkins Medical School. I've over 25 years of experience treating cancer patients, and I've been working at the Island Cancer Center for the past 2 years.
So we'll get right to it. We want to learn more about cancer and what cancer is. So can you kind of give us an explanation? We know so much about it. We hear so much about it. Friends, families who are afflicted with it. But what exactly is cancer?
Cancer is a complex disease. To put it simply, cancer is caused by normal cells going bad. To put it into perspective, it is estimated that there are 37 trillion cells in our body, trillion, compared to about 8 billion human beings on Earth. So there are 5,000 times more cells in our body than the whole population on Earth. So to keep all these cells working properly, there are many complex and delicate biochemical systems of checks and balances. So over time, these checks and balances can be corrupted and errors can accumulate. So the cells may die from the errors that accumulated, or they become transformed and become cancerous.
Okay, so cells dying, that's a normal process. Them turning into cancer is what's the problem.
Correct.
Okay. So how are these cancer cells different from normal cells?
That's a good question. There are three main characteristics of cancer cells. First is cancer cells can divide and grow uncontrollably. Secondly is cancer cells can invade and destroy the neighboring tissues and organs. And thirdly, which is the most lethal, is cancer cells can spread or migrate or metastasize to other parts of the body, which makes it very difficult to cure.
How do they spread, though? If they're, I'm a little confused by that. If they're dead,
No, they're not dead. They either die or they transform into a
cancer cells.
abnormal living organism, almost. Abnormal cells that would grow and migrate and take over the body.
And so how does that happen? Have they been able to identify how exactly they spread?
Through different mechanisms, the cells invade the blood vessels and the lymphatics and travel through the lymphatics and blood vessels to migrate to other parts of the body and form new colonies.
I see.
And as they do so, they destroy the normal tissues and eventually destroy the body.
Are there any, is there a way to identify whether or not somebody might be developing cancer? How are the early signs, early detection of cancer? What are ways to see that maybe somebody might develop it or is at risk for developing cancer?
Early cancers may be asymptomatic, so the patients may not have any symptoms or signs. So we have screening tests to pick up early cancers. The idea is to find early cancers so that we can destroy them before they become life-threatening. So we have screening mammograms for breast cancer. We have low-dose CT scans for lung cancer for people who smoke. We also have pap smear for cervical cancer. We have colonoscopy to pick up colorectal cancers. So if we detect them early, we can destroy them before they become a problem.
What about tumors? You know, sometimes you hear about benign tumors and malignant tumors. How do you differentiate what's cancer and what's not, even though they're both considered tumors?
Right. Cancers are malignant in the sense that they destroy normal tissues surrounding it and they can spread and destroy the person. The way to diagnose cancer versus benign tumors is that we remove a piece of it. We biopsy the tumor or the cancer, and we look at the specimen under the microscope. The pathologist is a specialist who would look at the specimen under the microscope, and cancers look differently. So using special stains and other methods, they can identify cancers and classify them accordingly. So normal cancers or cancers are usually classified according to the origin of the cell and the organ where it came from. So, for example, squamous cell carcinoma of the skin, which is a common skin cancer. Squamous cell meaning the lining of the skin, so the cancer came from the lining of the skin. Or squamous cell carcinoma of the lung, lining cell of the cancer of the lung that became cancerous.
I see. Okay.
And after we make the diagnosis, we usually do what is called staging, meaning that we perform a series of x-rays or diagnostic scans to find out the extent of the cancer, where and how many of the cancers are there in the body, and whether it has spread to other parts of the body. With this information, then we can decide the best treatment course for the patient.
Okay. And you mentioned a couple types of cancers just now, you know, with the skin cancer and all that. But we hear about a lot of different types of cancers. You know, there's breast cancer, there's brain cancer. How many types of cancers are there?
There are about 200 types of cancers in human. And again, they are named after the organ that it originated from.
Would it be possible to discover a new type of cancer in the future that may not have been discovered in the past?
Possibly, but I think we have discovered most, if not all of them.
Okay.
And different cancers behave differently. And even the same type of cancer in different patients may also behave a little differently, and also they may respond differently to therapy.
I see. Okay. So when you say they behave differently and respond differently to therapy, so for example, somebody with brain cancer might get a different type of treatment than somebody who has breast cancer or prostate cancer.
Correct. The treatment will be different for each type of cancer.
Okay. Are there any cancers that are more aggressive than others, that they might have to go through a different type of regimen?
Yeah, there are cancers that are readily curable. For instance, simple cancer of the skin that can be readily removed by the surgeon, and then the cure will be 99+%, versus very malignant cancers like brain cancers or brain tumors or pancreatic cancers where the cure rate is very low.
Okay. So earlier you talked about stages.
Yes.
And you know, we do hear a lot about that, stage 1, stage 2, stage 3. Can you kind of explain a little bit about those different stages?
Staging system is designed to allow us to categorize the extent of the cancer so that we can plan how to best treat the patient and also give us an idea of the prognosis. So usually stage 4, we have stage 1, 2, 3, 4. Usually stage 4 is the worst, meaning that it's most extensive. It usually has spread to other parts of the body, which is much more difficult to cure, versus stage 1, where the cancer is localized and there's a good chance of cure.
Okay. Now, in terms of prevention, I know we talked about diagnosing and you know the history or what causes cancer, but what can people do to prevent it from happening? It seems almost impossible. You know, you always hear about statistics like 1 in 3 is going to develop breast cancer at one point in their life. But is there anything that we can actually do to prevent cancer from happening to us?
First, let me go into the causes of cancer. There's no one cause of cancer. There are many different risk factors for cancer, and sometimes certain cancers are results of many risk factors working together to cause the cancer. So about 5 to 10% of cancers are due to hereditary factors, meaning that a defective gene or mutated gene is transferred from parents to the offsprings, making them more susceptible to certain cancers. About 20% of the cancers are due to infections. It could be a bacterial infection, some type of bacterial infection, or some viral infection. Viruses are non-living infectious agents that can infect living cells, forcing them to produce more of the same virus. And in doing so, may cause cancer in some people.
I see.
So the rest of the risk factors are related to lifestyle, habits, diet, hormonal environment of the body, or environmental, be it chemical or radiation. So to prevent cancer, we can try to avoid some of the risk factors, like smoking. Smoking is a big risk for lung cancer. Smoking, the tobacco smoke has many carcinogens. Among them, the benzpyrene is documented to be a carcinogen. So with smoking, we create a film of toxins in our mouth, in our throat, in the airway, in the lung, and increases the risk of cancer in those areas. Those toxins can also be absorbed into the body and excreted into the bladder, also increases the risk of bladder cancer. So if we can avoid smoking, we can avoid a lot of the cancers that I mentioned. Secondly is betel nut chewing. Betel nut chewing is more prevalent in Southeast Asia, India, and Africa. And they do cause mouth cancers, terrible mouth cancers. And if they chew tobacco along with betel nut, the risk is even higher. So if we can avoid betel nut chewing, we would also reduce certain risks of mouth cancer. Ultraviolet radiation, we can avoid ultraviolet radiation by using sunscreens, especially for people who are fair-skinned. Other ways to prevent cancer, we can use vaccines. I mentioned certain cancers are caused by infection. So there are vaccines for certain viruses. Hepatitis B virus can cause cirrhosis, which is inflammation, chronic inflammation of the liver, which can cause liver cancer. So there is a vaccine for hepatitis B, usually given to newborns. There's also a vaccine for HPV virus. HPV virus is human papilloma virus, and it is responsible for many cancers. It's responsible for almost 100% of cervical cancer in women. And it can also cause vaginal cancer, vulvar cancer in women, throat and anal cancer in both sexes, And there's a vaccine for it too. And usually recommended for teenage boys and girls.
Okay.
So if they get vaccinated, then the risk of getting those cancers will be significantly reduced.
Okay. What about treatment? I noticed that your title is radiological oncology. Can you kind of explain to us what the different types of treatments are available?
Cancer treatment could be very simple, like removing a small skin cancer by a surgeon, or it can be very complex with a combination of surgery, chemotherapy, and radiation, and its various combinations. Recently, we have made dramatic advances in understanding how cancer is developed. And since 2000, we have mapped the human genome, so we have identified certain genes that are associated with cancer. With the understanding of how cancer works, there's a new class of therapy called targeted therapy, which is given by the medical oncologists, which targets specific abnormalities of the cancer cells. That improves the treatment of cancer and improves the results. As far as radiation is concerned, radiation, we use high energy X-rays that we cannot see or smell, and we can target the high energy X-ray with multiple beams to concentrate in the cancer area to kill the cancer while avoiding the normal tissues around it. So there are three main advances in radiation in recent years. First is the advancement in diagnostic radiology to allow us to identify the cancer more accurately so that we can target the radiation while avoiding the normal tissues. Secondly is we have sophisticated computer algorithms or planning methods so that we can customize the radiation treatment to deposit the radiation to the cancer, again, while avoiding the normal tissues surrounding it. And finally, we have very advanced machinery so that we can deliver the radiation with millimeter accuracy to the tumor area.
Wow. So you kind of gave a little bit about brief treatment guidelines available for cancer. What about a cure? You know, that's like the big question. Have we ever been close to one or even developed one?
The term cure is relative in the sense that if the cancer is found early, before it has spread, and we can totally destroy the cancer either by surgery or combination of surgery and chemotherapy, the patient would have a very high chance of cure. Cure meaning that eliminating all the cancer cells in the person's body. And if we can achieve that, the person is cured.
I see.
However, if the stage of the cancer is higher, then we may or may not be able to achieve total eradication of the cancer. So in stage 4 patients, in certain instances, we can still cure the patient, but in a lot of other instances, we may not be able to cure the patient. So we can only help to control the cancer for as long as possible, and also to alleviate pain and suffering.
Okay, and my final question. Who is at risk for cancer? And if you can maybe, some people might be wondering, how long has cancer been around? When was it discovered?
Cancer has been around since human beings have been around on Earth. And if we look back into history, and we found mummies nowadays where looking at the skeletons, we know that they had cancer thousands of years ago. So cancer has been around forever, so to speak. It's just that in the past, people don't live as long to get cancer. They die from something else. Everybody is at risk for cancer. Unfortunately, because we are made of many cells, and the cells in our body are prone to getting cancer if there are enough risk factors assaulting our body. Chemicals, environment, hormones, bad lifestyle, etc., even aging. The system is not perfect. As I mentioned, the checks and balances, the spontaneous mutations, there are things that would change the system in our body so that some of the cells may become cancerous.
Okay. So really anyone can get it? There's no...
We can only minimize it. We cannot totally eliminate it.
Joining us now is breast cancer survivor Tashana Smith. Tashana, welcome to the show. Thanks for joining us, and thanks for agreeing to be interviewed and share your story with us.
Thank you.
So I'm going to go right to it. What was your life like before the breast cancer diagnosis?
Well, before that, my daughter and I were just coming to some kind of normalcy in our life. Prior to that, we had lost my husband through a drunk driver while he was in the line of duty. So our life was just beginning to get back to our kind of normal, I guess you can say. And so this threw me for quite a bit of a curveball.
Yeah, I can imagine. Yeah. Well, how did you find out? Did you have any types of symptoms? How did you find out about the breast cancer?
Well, as you know, there's always been that growing up, you do your own kind of self-examination. So that was instilled to me at a young age during my teenage years. So I was just doing that. It was, and I was doing that in the shower, and I found a lump. And so, which was, I guess you can say, kind of perfect timing, because the following month was my annual pap smear OB appointment. So when I mentioned it during my exam, of course, my doctor went ahead and started ordering the other tests. We did an ultrasound. That came back negative.
Oh, okay.
We did a mammogram. That came back negative.
Wow.
And so I kept telling her, I says, no, we need to figure this out. I can feel it. You can feel it. You know, what's the next step? So we did a biopsy. And now, mind you, it was May I found out. End of May. June was when we first started doing the test.
This was in 2012.
This was in 2012. So September 4th of 2012 was when I got the actual diagnosis that I had invasive ductal carcinoma, which is breast cancer.
Right. So you insisted. You told your doctor, no, I feel it. Were you in any kind of pain?
No, that's the ironic thing. I wasn't in any kind of pain, and it was somewhat high on me on my right breast. And it just felt like a knot, like sometimes when you bump yourself, you can feel that little lump. So that's what it was to me. But I just kept pushing it, you know. I said, no, I need to know if it's nothing to be concerned of. Can we take it out? If it's something to be concerned of, what is my next step?
Initially, before they gave you the official diagnosis, before they did the actual biopsy, what did they think it could be?
I didn't want to speculate, so. I guess we were both very optimistic, my doctor and I, and she just kept saying, well, you know, we don't see anything. When we did the mammogram, we didn't see anything. But I guess it was just because I felt it and I knew it was there, I needed to know what it was.
You needed to know what it was for sure.
Yeah.
How old were you at the time?
I was 38 at the time.
Okay.
Yeah, so mind you, I didn't meet any of the parameters.
Right, because normally it's like 40 or 50 even before women start to do their annual mammograms and all that stuff.
That's correct.
So you were 38 and you insisted. That's amazing, you know, that you insisted upon it yourself instead of, you know, just going with that kind of advice.
Right.
Because that really, to me, it seems like saved you.
Yes.
Yeah.
Well, you know, life is short, and like I said, my daughter and I went through something, so I needed to make sure that what I have is nothing to worry about or is something. I just didn't want any speculation.
Okay. So when you first got the official diagnosis on September 4th, who did you tell first? Who did you go to?
I went to two of my girlfriends. Yeah, I went to them first because, sorry. It's okay. It was difficult. I had to figure out how I was going to tell my daughter. And that was the biggest thing. Was trying to figure out how to tell her. And she was in school at the time that I found out. Actually, yeah, she was in school and then she had practice afterwards. So I went to them and basically just bawled my eyes out, you know. Because I really didn't want to cry when I had to tell her.
Right.
Yeah. And so one of my girlfriends, she picked up my daughter from practice, and we met at a pavilion by the beach. I wanted something where it's just going to be the two of us, and I didn't want family around just yet, because I wanted it to be focused on my daughter. And so I told her there, and it was the first thing that came out of her reaction was I was not expecting. The first thing she asked me was, Mom, are you going to die like Dad? And I think it was at that point that I said, all right, For one, no, I'm not. And we are not going to let this define us or define my life.
Right.
So instead, I made the decision right then and there that not only what I was going to fight, but I wasn't going to allow it to control my daily routine, my daily lifestyle. I mean, I knew there were going to be changes because of what I needed to go through, but I promised my daughter at that point in time that I wasn't going to miss any of her school functions, whether it be a Christmas program or anything like that, any of her other activities. Because at the time, my daughter was playing sports for her school. She was also in martial arts. So I promised her right then and there, I said, we're going to go, we're going to take care of this, and I will be at all your games, all your, I won't miss a thing. I won't let this control us.
You won't let it change the relationship that you had with your
Exactly.
daughter. At what stage were you? Did they give you a stage?
At that point in time, I didn't know the stage I was in.
Okay.
When I looked into it, the doctor that I met with here said we wouldn't be able to determine that until we actually went in and I had the surgery. So from there it was, okay, do I have a lumpectomy or do I have a full mastectomy?
Right.
And so in doing the research that I did and talking to my doctor, and of course with my family, I decided I'm going to go with the lumpectomy first. So after notifying my daughter and the rest of my family, the first thing I told my family was no pity. I want to walk in through these doors the same way I've always done, and I told that to my friends. I said,
treat me no differently.
Pity. Yes. No tilt head, how are you doing kind of thing. It's straight up, hey, what's up, how you doing kind of stuff, And I had just wonderful, wonderful support from then on.
That's amazing.
So it was helpful. It kept me positive, kept my daughter positive, and through all that, I'm here.
Yeah.
And still here. So.
When you got the diagnosis officially, and you mentioned that they didn't have an actual stage yet at that time, I can just imagine how difficult that was for you, not knowing whether you were stage 1, 2, 3, or 4, how severe it was, what the prognosis could be like. Tell us, what was it like during that time frame, getting the diagnosis and just trying to figure out what to do next?
Well, first getting the diagnosis, of course, I was in shock. It's like I went tone deaf. I didn't hear anything else my doctor had said but the fact that I had cancer. So after dealing with that, I drove, and like I said, I went to my girlfriend's first, and then trying to figure out, okay, so I know I have it. Do I have, I guess my biggest fear was, where else do I have it within me? I know I found that one.
Did
do
it
I
spread?
have, exactly. Do I have any more cancer cells throughout my body? And because I found out around May and going through all the tests, it wasn't until September when I got the actual diagnosis. So you're talking a few months.
Right.
And, cancer can spread like wildfire, And I guess I kept that optimistic outlook on it, and I started telling myself, okay, it's small. I can feel it. It's small. So I'm hoping it's stage 1, because it did feel tiny, like a quarter, like a dime size, more or less, So I was concerned, but again, I wasn't trying to overly worry myself. My focus was then on, okay, let's do the research. Let's decide, what am I gonna have first, So I decided I'm gonna have the lumpectomy. And then it was focusing on what are the side effects of cancer. I just started going into researching all that I can. It wasn't about, again, it was just more or less just trying to control the situation. So the more knowledge, the more research I had, the more positive people around me I had, the easier it was to focus on that. I don't know, I just wanted to make sure that hearing the words wasn't going to be a death sentence for me.
Yeah. What was the official diagnosis again, if you can just repeat it?
I was diagnosed with invasive ductal carcinoma, which means that the cancer cells was in my milk ducts.
Ducts, I see.
Yes,
I see.
which could also spread to my lymph nodes.
Right,
yes.
Because they're all kind of connected.
That's correct, yes.
And they're all over our necks and our upper body. Right.
And I did find out when I went off island to have the surgery done that it did spread to 2 of my lymph nodes.
Wow.
Yes. Yeah.
So it did spread?
Yeah.
Okay,
Yeah.
so let's take a step back. You got the official diagnosis. You decided to remove it through
Yes.
a minimally invasive type surgery?
Yes, it was just an incision that they made
Okay.
and to remove the
to
lump.
remove it.
Yes.
But it did spread
Yeah.
to other.
To the lymph nodes. Well,
Okay.
because they are connected, so yes.
Okay.
Which I had to actually end up going into 2 surgeries. I was only scheduled for one, but at the time they weren't able to take out all of it.
I see.
So I had to
so
go
they had to do a
in
second
week
one.
later. Yeah.
Okay, and that was for the cells that spread.
Yes.
Okay, I see. Okay. After your surgery, what did you do then? I know you mentioned earlier to me off camera that you had some chemotherapy done.
Yes, that wasn't. That was later when I returned to Guam, and I started in November.
Okay.
But immediately after my surgery, after I was released from the hospital, I took my daughter and we went down to because we were in LA.
Oh, okay.
So I took her down to Hollywood Boulevard, and I didn't, as much as in pain as I was in, I was like, no, we're gonna go. We went to the Wax Museum.
Yeah.
We went all around.
You had a good time?
Yes, I had a good time. My family, my parents were out there with me. So everyone kept saying, you need to rest, you need to rest. And I was like, no, I'm good. I'm good. I'm a Leo, I'm stubborn, I'm good. Let's go turn this into something for my daughter. So
Yeah.
that's what we did. And then in November, because I knew once I came back home, my life's going to change a little bit because of the chemo.
Yeah.
And then eventually because of radiation. So when I came back home in November, I started chemo.
My final question for you for now. What is your advice for other women who may find themselves in the same situation?
I guess my advice would be, don't take it as a death sentence. Be as stubborn as you can, and fight and push and focus on the positive. If you have children, focus on them. That's what I did. I focused on my daughter, and continue your self-examination. Spread the word that, do all the pre-screenings, because I was, like my doctor had said at the time, I was an oddball. I was 38, physically active. I played sports with my daughter.
Wow.
So I didn't have any.
You didn't fall in that category.
I didn't fall in any of the
risks.
categories. I don't smoke, drink occasionally, but I didn't fall in any of those parameters. So it was really a shock to myself, to my family. I ate well. I'm not a junk food kind of person too much. But yes, so when you do get it, just continue to push forward.
Yeah. All right, well, thank you very much. Don't go anywhere. We'll be right back. Coming up next, actually, we have Tashana's daughter, Kayana Smith. She's going to be joining us, so don't go anywhere. My Story will be right back. Hafade, and welcome back to My Story. I'm Janella Carrera, and again, earlier I mentioned that we have Kayana Smith joining us, Tashana's daughter. So I'd like to introduce you all to Miss Kayana Smith, and again, welcome Miss Tashana. Kayana is just 15 years old,
yes.
Right? But Kayana, tell us, how old were you when your mom was first diagnosed?
I was only 12 years old.
You're only 12?
Yes.
Wow, very young, tender age. I was talking with your mom earlier, and she kind of gave us a little bit of a brief story on what it was like for her to get the diagnosis and then share this story with you. But I want to hear more from your side. What was it like for you, a young 12-year-old girl who had just lost her father and now she's getting this news from her mother?
Yes. Well, at the time, since I was only 12, I was mostly scared, but I still wanted to be there for my mom, mostly because of the loss of my dad. So I just wanted to be her rock.
Did you understand, what cancer was or what this could mean at that time, at 12?
At the time, no, because as I was still a kid, I didn't know what was going on. I just know I had to be there for her.
That's good. That's good. So, at the time you were 12, you were in middle school, I imagine.
Yes.
Enjoying yourself at school, your friends. Your mom was telling me that, you were into a lot of sports. How did it change, what your routine was, or what it was like for you to go back to school and do all the normal activities that you do as a 12-year-old.
It didn't change as much as I thought it would. I just had to not so much focus on school for a little bit and just focus on her.
And when you say focus, like what are some of the things? Did you go with her to like appointments, things like that?
Yes, sometimes when I can. Other times I couldn't make it, but I'll always ask her about it afterwards to see how she is.
Yeah. And so at 12, a lot of us have a bunch of friends. We're in school. Your friends, did you share any of this with your friends at school?
I did, and they were very supportive. Like when we were out there, I would call one of my friends, Abby, and all my friends would come up to the phone and say hi and ask how everything is, and they would just take my mind off it.
So when you first found out about your mom's diagnosis, you went back to school. I imagine you shared it with like some of your closest friends.
Yes.
What did they, how did they react and offer their support to you?
They were shocked, and they just told me that if I needed anything, just to go to them. If I needed to talk, then I could talk to them.
Did you ever cry or anything like that?
No, really. Mostly because I had to be the rock for her and my family.
Wow, that's amazing.
She took on a lot on her shoulders.
I mean, that's on top of all you mentioned she was doing a lot of sports activities.
And I think that's what helped her, is because she was involved in so many things. And I think that's what helped me as well, is she needed to focus on the game, or she needed to focus on, whatever other activities she was doing. So, and then it also helped that a lot of her friends, she's known since she was like 4 or 5 years old. So it's more like there's her siblings, not just friends.
Right. So these were like the sisters you didn't have, the brothers you didn't have.
Yes.
Yeah, that's great. Okay, so now, your mom, you mentioned you traveled to LA to get the surgery.
Yes.
And you went with your mom.
Yes.
What was that like, knowing that your mom was, going to surgery, being taken back into a room, and you had to wait there to find out, what's going on with your mom, how things go?
Mostly to take her mind off it, to make her laugh, do weird stuff, just to see her smile.
She did some weird stuff before I went into the operating room, and she made me laugh quite a bit.
Wow, at 12 years old, that's
Yes.
amazing. That's amazing.
And she had my parents there, so when I went in, they were, I think you guys did a prayer, right? Mama made you guys do a prayer. But my mom told me that she did go off to the corner and said her own little prayer.
Own prayer.
Yes.
What were you praying for?
For her to get better, so we could go back and just forget everything happened.
Now, tell us, after the surgery was done, your mom had mentioned that out in LA, you guys did some, family bonding type things, some fun activities.
Yes.
Did that help you?
It helped to lighten the mood, to make us all laugh, just enjoy our time with each other.
And during this whole experience, you were 12 and now you're 15, but at the time, what was your biggest fear? What were you scared of the most?
The thing I was mostly scared of was to lose my mom too, because I already lost my dad, so I didn't want to lose another parent.
You didn't want to lose your mom. Are you guys very close?
Yeah.
Tell us about your relationship.
Oh, wow. We have such a strong bond that people sometimes they will tell us that we look like sisters.
You do.
Mother and daughter.
You do.
Yes. We sometimes I'll walk out of my room, she'll walk out of hers, and we're going somewhere, and we're wearing either the same color or the same
Style
T-shirt, just something, and it's, and then we'll just walk in. Either we'll keep it and we'll just like forget it, or we'll, one of us to change. But I mean, she jumps on my back, and I piggyback her. I jump on her back. Well, mostly I jump on her back now because she's a lot stronger than I am. But we still do one-on-one basketball. Just the other day, I have a scrimmage game in volleyball today, and she was actually coaching me. She's training me, Mom, overhand serve like this, and so I guess because from my childhood, I'm an only child as well.
I see.
Very close to my parents.
And you're an only child.
Yes.
And so, so that bond It's always been there. And I saw it with my parents, and I wanted to do the same thing with mine when I had a child. So we did.
What do you love most about your mom?
Mostly that she's really strong in what she does and how she's very independent and stuff.
And that inspires you.
Yes.
And I imagine that your mom's strength and you know, all the things, all the examples she set for you growing up, that helped you become the strong daughter and person you needed to be.
Yes.
For your mom when she found out about the diagnosis.
Yes.
So you're 15 now. It's been about 3 years since. And, you know, the first year I can imagine, the first few months must have been really difficult. But after that first year and moving on into high school, now you're in high school.
Yes.
What has life been like for you?
It's just been back to normal, I guess, or our kind of normal, and still being there for her and supporting her and everything.
Yeah. So, you know, getting a diagnosis of cancer, like you said earlier, is not a death sentence. And it's proof that, you know, two people, a family can still, you know, go on and survive and have a really good relationship. And I can see that in both of you.
Yes.
Now, Kiana, now that, you know, your mom is technically cancer-free, going forward, you know, what are you hoping for? What are you looking forward to?
For all of us, just to have a great time, enjoy the time that we have together, and just be there for each other.
What do you want to be when you grow up? It's off topic,
shoot.
Just curious. I mean, because you're into so many sports. Yes. You mentioned she plays the youth.
She has a
She's
lot
into
of
music.
things she wants to do. I mean, we just took a trip out to D.C. this past summer where she attended American University. So she got to experience college life, live in the dorm and all
nice.
of that. Yeah, it was part of the national conference that she was a part of. But she has, go ahead and just tell her just a couple of what you want to do. I mean, she's got a lot. Very ambitious.
Part of it, I wanted to be in the Marines. And
wow.
Another job, I wanted to be a police officer for my dad. And then I wanted to be a storm chaser ever since I saw the movie Twister.
Storm chaser, that's funny. All right, well, here's my final question for you, Kiana. What's your message to your mom? I know you say that you've been her rock, you know, for most of this experience, and I can imagine she's been your rock as well. But what do you want to say to your mom? And you can tell her right now if you want to, or you can tell me.
Oh, you put her on the spot.
I love you. I don't know. I mean, I said everything already, and she knows how I feel about her.
Yeah.
Yeah.
Just I love you.
and your mom, your message to your daughter?
Keep pushing forward. Keep reaching those goals, whether it be a storm chaser or, you know, you do go into law enforcement. Don't let anything stop you, and I've always told you that. And when you have your children, you make sure you go to every game, go to every program, you know, you don't miss a beat. Well, when they don't listen.
All right. Well, thank you, ladies, so much for joining us and sharing with us your very brave story. Thank you, Kiana, for joining us. I know you're only 15, but you've got a great daughter here. All right. Well, thank you again for joining us for this very touching interview between mom and daughter. Coming up next in the show, we'll kind of talk more about breast cancer itself. We'll learn more about it. So don't go anywhere. We'll be right back. I'm Janella Carrera. Thanks for watching My Story. Hafaday, welcome back to My Story. We just heard from breast cancer survivor Tashana Smith, and to fully understand breast cancer, we sought out the knowledge of Dr. Ellen Bez from Mariana's Physician Group. So before I introduce you to her, let me share with you her medical background. She came to Guam in 1993 and practiced internal medicine at PNC Isla Health System. Then in 1999, she began her private practice, teaming up with Dr. Annie Bordalio and Dr. Rosie Villagomez to form their current practice, MPG. Dr. Bez is also the president of Sagwa Manyagu Birthing Center. She earned her medical degree from Howard University College of Medicine. She then completed her residency at the North Shore University Hospital, Cornell University Cooperating Hospital in New York. And She is certified by the American Board of Internal Medicine and the National Board of Examiners. What an impressive resume. Now that you know all that about her, let me introduce you to Dr. Ellen Bez. Welcome to the show, Dr. Bez.
Thank you, Janella. Thank you.
All right, well, so we're here to talk about breast cancer. I'm going to get right to it.
Sure.
What is breast cancer?
Well, let's start out with what is cancer, because I think from that it's easier to talk about what happens in breast cancer.
Okay.
In any organ, breast, liver, kidney, something can happen, whether it's genetic, whether it's environmental, or a combination of two, that causes some of those cells, and in the breast it would be breast cells, that causes them to abnormally multiply. And again, it's we don't know whether it's genetic or environmental, probably a combination.
Right.
So something starts, the cells start rapidly dividing and get out of control and overgrow.
Okay.
And that's what happens in the breast. So breast cancer is an overgrowth and an out of control multiplication of those cells. Now in the breast is, the main function of the breast is for breastfeeding,
right,
for women. And so we have ducts, milk ducts, and we have lobules in the breast. That's the main components of the breast that produce milk, right? And within that, there's a lot of fibrous tissue in the breast that helps support the breast and all those ducts. Now, breast cancer happens when either the ducts or the lobules, those type of cells overgrow and become a tumor.
I see.
So in breast cancer, there are several types of breast cancer. The majority of cancers form within the ducts,
Okay.
and after that it would be the lobules.
Okay.
And there's also less significant, not as many numbers of something called inflammatory breast cancers that actually occur on the skin. And
I was going to ask about that. On the skin, would that fall within the breast cancer
it
category?
is a breast cancer.
Okay.
It's called an inflammatory breast cancer as opposed to a duct or a lobule breast cancer.
I see.
And then there's also some breast cancers of the nipple. But by and large, the majority of breast cancers occur in the ducts and the lobules.
Okay, so inside of
Inside the breast, and it's just those cells overgrowing due to something that triggered them, and they become abnormal and just grow out of proportion to what they should be.
I see. Okay. And you mentioned something about a combination of both environmental and hereditary, but based on evidence or statistics, what does it say? What does it point to?
Well, 60 to 70% of all breast cancers occur in women over 50. So advancing age is probably the #1 risk factor. And right behind that is heredity. So if you have a relative, a mother, a sister who has breast cancer, you're at a greater risk for developing it. Other risk factors for breast cancer are women who have had multiple biopsies, multiple sort of, not really breast cancer growths, but multiple benign growths. That's another risk factor. But the two biggest ones are probably advancing age and a history of family members, a family history.
So when you say benign growths, these could be lumps within your breast that are not cancerous.
You know, cysts.
Cysts,
There's
right.
Women can have cysts in their breast. They can have solid nodules that are really adenomas that are just, again, that fibrous tissue that's become tumorous, and you take those out and those aren't cancerous lesions.
I see. Okay. Now, in terms of hereditary, you mentioned, maybe somebody might have a mother or a sister, a relative who might have had breast cancer in the past. What about other types of cancers? If they've had other types of cancers, could that then possibly lead to breast cancer, hereditary?
Well, anybody who has had another cancer has a higher risk to get another cancer. Okay. But the interesting part, and a point I wanted to make with hereditary, if you have a family history of a bad gene, of a BRCA gene, or one of the genes that we now know can cause breast cancer, that's a bigger risk if your relative got the cancer premenopausal. So if your mom or your sister had menopause when was diagnosed with breast cancer in their 30s or 40s, that's a bigger risk to the family member than if your family member was diagnosed with breast cancer in their 50s or 60s or 70s, then it's not so much of a hereditary risk.
Okay, because then that it would indicate that it was more of advancing age.
Exactly.
I
correct.
see. Okay, that makes sense. Now, what about breastfeeding? Whether or not a woman breastfeeds or ever has to breastfeed by getting pregnant, is that a risk factor?
Actually, women who don't breastfeed have an increased risk of getting breast cancer. So breastfeeding is a good thing to reduce.
For both baby and mom.
For both baby and mom.
I see. Okay, so breastfeeding helps.
Breastfeeding is good.
Keep that in mind. Breastfeeding helps.
Right, right.
And now, speaking of breast cancer, where we've been talking about women, what about men?
Good question. You know, men do get diagnosed with breast cancer. Men have the same architecture in the breast as a woman. They have ducts, not quite as many lobules that make milk, but their breast is constructed the same way with ducts and fibrous tissue. The difference for men and women is that women, under the influence of estrogen, the hormone that controls our reproductive system, under the influence of estrogen, it causes the breast to grow. That's why women have larger breasts than men. So under the influence of hormones, our breasts develop and become milk-producing organs for when we have children.
I see. Okay, and so for men, we don't hear too much about breast cancer in men because they don't.
They don't have the same hormonal stimulation, which is thought to increase the risk of breast cancer. Their breasts are smaller. Actually, men comprise less than 1% of all the breast cancer diagnosis. But it is something to be aware of. It is something to check if you notice a lump in your breast, whether you're a man or a woman.
Okay, so for checking, doing screenings and testings. And all that.
Yeah, let's talk about screening, because just this week, actually, there's been some new recommendations about mammography. So the two ways to diagnose, or the two most common ways to diagnose a breast cancer, is if a woman feels a lump, or if a doctor during their exam feels a lump, and the other is mammograms. And certainly screening and mammography have done a great service to all women in terms of reducing the incidence of breast cancer and early detection. So the new recommendations are, and again, recommendations get made, but it's really what the insurance companies end up deciding is the guideline that they're going to follow. But right now, the new recommendation is to start screening at 50 every other year, where before it was 50 every year.
This is for mammograms.
50. This is for mammograms. And between 40 and 50, what every woman should do is have a discussion with their doctor about their risks. Do you have a family member? Have you had multiple biopsies? You know, if you fall into a higher risk category, there is some reason to think that women between 40 and 50 should get mammograms. But that's a individual decision made with a patient and their doctor.
So that's really based on the patient.
That's based on the patient's risk factors.
Okay, and then I guess my last question would be, what types of treatment options are there for women who may be diagnosed with breast cancer?
Right, and when you get diagnosed with breast cancer, the big thing is the most important thing is to see your doctor and find out what size is your tumor, what's the stage. So one of the first things is staging. If you have a low stage breast cancer, some of the therapies are you can just have a lumpectomy, just remove that and radiation. If you have more advanced disease, then you start in to add a bigger surgery. You also get radiation, you add in chemotherapy, and then for the different types of breast cancer, there are different drugs that get used. So surgery is the big one. Then there are chemotherapy, radiation, and hormone treatments. And just remember, for women now, breast conserving treatments are really help us stay feminine and not be so disturbed with body image after you have surgery to the breast. So talk to your doctors about breast conserving therapy also.
Okay. All right. Well, thank you so much,
You're
Dr.
very
Bez,
welcome.
for
You're very welcome,
joining us
Janella.
on this show and giving us an in-depth look at breast cancer. We really appreciate it.
Thank you.
All right. Well, don't go anywhere. We'll be right back. You're watching My Story. I'm Janella Carrera. We here at My Story aren't the only ones fighting to bring awareness to cancer and cancer prevention. Thank you, Dr. Annette David at the University of Guam's Cancer Research Center outreach team, the American Cancer Society Guam, and those who put statistics together at the Guam Comprehensive Cancer Control. Along with these great individuals and their organizations, we all work together in hopes to end cancer altogether. And before I close out the show, here are some great local organizations working to assist patients diagnosed with cancer and their family members. And these organizations are committed to the fight against cancer on Guam. Well, thank you very much for watching this episode of My Story. Also, a huge thank you to Dr. Au at Island Cancer Center, Dr. Ellen Bez, and of course, a special thank you to Tashana and Kayana Smith for sharing their cancer survival story as a team. We here at My Story wish them nothing but the best in the years to come. I hope that you join me for the next episode in February, where we will feature another brave cancer survivor. If you have a cancer story that you'd like to share, please email us at share@spbguam.com. And to find out when to catch the rebroadcast of this episode, download the PNC News First app for showtimes on Channel 6 and Channel 7. Until next time, stay healthy, stay strong in the global fight against cancer. I'm Janella Carrera. Thank you. Good night.